Hello, and welcome to the physiotherapy pre-assessment for a total hip replacement at Woodlands Hospital in Kettering. In today's session, we'll be going through a few things that you can do prior to coming in for your operation, what to expect when you're staying with us here in the hospital, and also what to expect as part of your ongoing rehabilitation following your discharge. So without further ado, we'll get started with today's presentation. Okay, so the physiotherapy department headquarters is Schofield House, and it's a small building directly across from the main hospital. The contact number, as you can see on the screen, is 01536 536 814. And we encourage you to get in touch with us at any point during your treatment if you have any questions or concerns. A total hip replacement replaces the rough, worn surfaces of your current hip with new, smooth, artificial surfaces. A typical hip replacement joint is made up of titanium, cobalt chrome, and a strong plastic that acts as your new cartilage. A total hip replacement is a major operation, with over 90,000 total hip replacements performed annually here in the UK. A typical full recovery from a total hip replacement is 6 to 12 months, and each prosthesis is specific to the individual. The evidence is showing that a typical hip replacement has a lifespan of anything between 10, 15, or even 20 years. So what does your physiotherapy involve following a total hip replacement? Well, your post-operative physiotherapy is important, and it will include guidance and support in managing your recovery from the physio team. We will create a home exercise program with the aim of improving your strength, your range of motion, and your day-to-day function. So trying to get you back to whatever your normal is. We'll also do some gait re-education, which is essentially encouraging a normal walking pattern. So we appreciate when you have a very painful, uncomfortable hip, it's not uncommon to develop that abnormal walking gait. So our job will be to help you back to more normal walking. The key thing with physiotherapy is to understand the importance of those home exercises. It is essential that you do your exercises as instructed for you to obtain the best possible result. Here we have a very sped up version of what happens during a total hip replacement operation. In order to get the new hip into place, your consultant has to dislocate the existing hip before putting a new socket into the pelvis and a new femoral head or new stem into your thigh bone. This will be cemented into place. At this stage, your consultant will check the range of motion and do a suction check to ensure that the ball and the socket are functioning together as they should. Here are a few things you need to adhere to post total hip replacement. So due to the nature of the surgery in having to dislocate the original hip in order to get the new hip into place, that stretches a lot of the soft tissues and the supporting structures around the hip, the tendons, ligaments, and muscles. So to reduce your risk of dislocation after the operation, we put some precautions in place that significantly reduce the risk. The first precaution that you can see on the screen at the moment, do not bend your operated hip more than a 90-degree angle. So there's quite an emphasis on the height of the chairs that you're sitting in. You don't want to sit with your hips lower than the knees. It's a much safer position when the hips are higher than the knees. But this precaution applies every which way. So you wouldn't want to lean forward and pick something up from the floor, exceeding that 90-degree angle. Likewise, things like tying your shoelaces or putting socks on, you may wish to have some support when doing those things. And this is something we can discuss with you further when you come and stay with us. The second precaution is not to cross your legs when in bed or sitting. And quite often patients tell us that a pillow in between the legs does tend to serve as an unconscious reminder not to do that movement. The third precaution is not to swivel or twist on the operated leg. So you're much better taking small controlled steps rather than twisting on that operated hip. Due to these hip precautions, there are some sleeping restrictions following your operation. You are advised to sleep on your back for 6 weeks to protect your new hip joint. You can sleep on your operated side or your back between weeks 6 and 12 post-surgery. Once the 12 weeks have elapsed following your surgery, that's when your precautions are usually lifted. And at this stage, you can sleep it any way that is comfortable for you. Quite often, patients find this quite challenging, and the general feedback from our patients who have had a total hip replacement is extra pillows on the bed can go a long way in increasing your comfort. So you wouldn't necessarily sleep flat on your back. You might have a few additional pillows to kind of bring you into an upright position, and maybe perhaps some pillows either side of you, and again one between your legs. If you have any questions, please don't hesitate to ask. In terms of equipment, we will provide all of the equipment that you need during your stay and some items to go home with. So we'll provide you with a sliding sheet, a walking frame, a pair of walking sticks, a long-handled shoehorn, and also a raised toilet seat. Now, there are some items that can come in handy after the operation, but they're by no means essential. So if you wanted to purchase something like a helping hand, it's a little bit like a litter picker, or a sock aid, these things might come in handy. We don't provide them here at the hospital, but if you wish to, you can purchase these before the operation. If you feel you have any specific mobility concerns or requirements, please don't hesitate to contact the physiotherapy department. Now, in terms of what to bring with you in terms of your medication, the pharmacy team will discuss with you about any regular medication you take, either at pre-assessment consultation or via a telephone consultation. Please bring all medication that you take in the original packaging. Your regular medications can include creams, inhalers, or injections. And this may include medications that you purchase over the counter from your local chemist or supermarket. Please note, you will need to take some pain medication following your procedure that are not dispensed from the pharmacy on site here at the hospital. So you will need to purchase these items and keep them at home, ready for your return. These kinds of items would include paracetamol, ibuprofen, and any laxatives. In terms of what to bring with you into the hospital, you also have toiletries. Bring yourself an overnight wash kit so that you can get yourself freshened up in the mornings. We'd also advise to bring some comfortable day and night wear and some flat, well-fitting shoes or slippers with backs in for your physio. We also encourage you to bring something to pass the time, whether that's a book, a crossword puzzle, Sudoku, some music, or your digital devices to access the Wi-Fi on site. Before you come into the hospital, familiarise yourself with the exercises in your total hip replacement booklet. Practice each exercise and take a note of any that you find particularly difficult. This can help in managing your post-operative expectations. Continue all prescribed medication unless advised otherwise. And if you are a smoker, please refrain from smoking for 2 weeks prior to the surgery. If you do need any assistance in smoking cessation, please contact a member of staff. So here at Woodlands Hospital, we do 2 lists. We have a morning list and an afternoon list. And the morning list runs from around 8 a.m. until 1 o'clock in the afternoon, and the afternoon list from 1 until 7 o'clock in the evening. So for those of you on the morning list, you might have a arrival time of around 7 a.m. Please drink your preload drink provided just before midnight. And on the morning of the surgery, be sure not to have anything to eat. And this includes sweets and chewing gum. You're encouraged to drink clear fluids only up until 2 hours before your arrival time. So if you're coming in at 7 a.m., your cutoff is 5 a.m. So you may want to get up a little bit earlier than usual to have a few sips of water in the morning. For those of you on our afternoon list, so you have either a 12:30 or 1 o'clock admission, please drink your preload drink provided at 6:30 a.m. and cease eating 6 hours before your arrival time, including, again, sweets and gum. No sweets, no gum, nothing to eat at all for 6 hours prior to your admission time. You can drink clear fluids only until 2 hours prior to your admission time. So if you're coming in at 12 o'clock, you can drink clear fluids up until 10 a.m. Clear fluids can include tea, black coffee, and water. Absolutely no milk, no sugar, or anything like that. And continue your routine medication unless you've been advised to stop. So whether you're on the morning list or the afternoon list, it might be that you're waiting a little bit before you go down for your operation. When you arrive at the hospital, you'll be booked in at reception and escorted to your room on the hospital ward. At this stage, you'll be seen by a nurse, a consultant, your anaesthetist, and probably somebody from the physiotherapy department as well. After the initial hustle and bustle of your admission, you'll be waiting until you're called down to theatre. If you do find that you're waiting around a little bit, we would encourage you to have a look at some bed exercises or some breathing exercises while you wait. When they're ready for you down in theatre, you'll be escorted from your room to the first floor, and you'll see the anaesthetist before going through for the operation. You will be sedated before and during the surgery, and the operation lasts between 1 and 3 hours. A compression bandage will be applied to the operated leg following the surgery, and once you leave theatre, you will spend some time in the recovery room. Once recovery are happy that you're stable, you'll return to the hospital ward on the second floor. Upon return from theatre, you will have a catheter in place and some intravenous fluids. You'll also have some flotrons around your calves to assist with your circulation whilst your legs remain numb. Flotrons are they're kind of like some blow-up pumps, and they just help and assist with the circulation in your legs whilst you're not moving around. Now, the key thing for me on this slide is safety. Bearing in mind that your legs may be quite numb after the operation, it's not really safe for you to attempt to mobilize independently. So please, if you need anything at all, please do click on the call bell and ask for assistance. As we know, we've been starved of fluids and food in the run-up to the operation. So now that you're back from theatre, it's a great time to have a drink, regular sips of water, have a cup of tea or coffee, and we'll make some food available for you as well. In terms of movement, when that numbness subsides in your legs, it's safe and encouraged to practice some exercises on the bed as advised by your physiotherapist. These maintenance exercises could be as simple as moving your feet and ankles forwards and backwards, or a few circles if you can manage. Generally, we encourage to do some buttock clenches. So whilst you're lying or sitting on the bed, if you clench your buttocks firmly together for 5 to 10 seconds, this allows the blood from your feet to return up towards the buttock muscles, up to the heart, and then all the way around again. It just helps in keeping that circulation moving whilst you're stationary on the bed. The final movement would be to gently bend the knee on the operated side. Don't feel that you need to leave that leg, the operated side, in a straight position the whole time. That will leave you with a very stiff knee and a very stiff hip. So gentle bending of the knee and the hip is encouraged. Just be mindful of your 90-degree hip precaution. So if you're sitting very upright in the bed, you may wish to drop the backrest back a little bit before you start to do those kinds of movements. Okay, so if you've had your operation, if you've been on our morning list, then on the day of the surgery, we will be practicing some bed exercises with you. And then a little later on that day, we'll be looking to mobilize with you for the first time. Usually there's 2 of the physiotherapy team there with you, and we'll use a Zimmer frame to stand for your first time. So this is on day 0, the day of the surgery, that you'll be taking your first few steps. And we'll help you to mobilize to the toilet as required and progress onto walking sticks if necessary. For those of you on the afternoon list, you may not get up on the same day as the operation due to the anesthesia and sedation, but we would encourage you to practice some bed exercises, and you'll probably receive a visit from somebody from the physiotherapy team to look at those bed exercises together. Because you don't mobilize on day 0, if you're an afternoon list patient, you'll be seen by the physiotherapist early morning to help with your mobility. And that brings us down to physiotherapy day 1. So on day 1, the day following the operation, we'll continue with your home exercise program. Make sure that you've got a good understanding of those exercises and how to perform them with good technique. We'll also ensure that you're safe with your walking sticks, able to navigate a flight of stairs, and we'll practice dressing with a long-handled shoehorn, aiming for you to be discharged later in the evening, and we'll let you know with plenty of time so that you can arrange your transport home. Really important to understand pain following a total knee replacement, total hip replacement. All surgery involves some degree of pain, and you may be provided with additional painkillers when you go home. It is important to take these regularly as advised, gradually decreasing the amount as your pain allows. Pain management is really important in managing your comfort, ready for walking, ready for exercising. This is particularly important on day 2 following your surgery when you're back at home. You may experience increased discomfort when performing your home exercise program, but moving your hip, although at times uncomfortable, will help in reducing your pain, tightness, and stiffness. Before your discharge, it's really important to make sure that your pain levels are manageable. So be honest with your nurses about where you are with your pain score so that they can prescribe you with the appropriate medication. As well as having your pain under control, we want to know that you're safe with your walking aids, have a good understanding of your home exercise program, and able to complete the stairs as required. We will also arrange a home. We'll also arrange for you to have an outpatient's appointment. Usually this would be a face-to-face appointment, but with the current situation of the coronavirus, you may find that this is a telephone consultation or even a virtual consultation. When it comes to getting in and out of the car as a passenger, we advise you to park on level ground and give yourself a little bit of space away from the curb just to make life easier getting in and out of the vehicle. And travel in the front passenger seat with the seat back and reclined. And this is when your sliding sheet will come in handy. So placing the sliding sheet that we provide to you on the passenger seat, always move the passenger seat as far back as it will go. And I would recline the backrest as well, probably more than you can see in the diagram here. Getting into the car, reverse yourself towards the vehicle, give your sticks to driver, and then use the frame of the car or the car door to gently lower yourself down into a seated position. From here, this is where the sliding sheet comes into play. Gently slide in your buttocks backwards into the seat. You almost want to be sitting on the handbrake before you start to bring your legs around there. And be mindful of that hip precaution as you get in and out of the car. And getting out of the car, it's the same process in reverse. Now, the key thing following a total hip replacement, when you're getting yourself in and out of the car, be patient with yourself. Don't be frustrated if you're not doing these sorts of things as quickly as you think you should be. Really important to take your time, think about your precautions, put your safety first there, and you will find your own way, your own knack of doing things. When it comes to driving, check with your consultant after the operation that you are ready to drive. This is usually after your 6-week follow-up appointment, and be sure to ensure that you're covered by your insurance company before you get back behind the wheel. So we've got some general advice on this next slide, so it's not necessarily physio specific. A Clexane injection will be given to you following the surgery, and you'll be required to have these blood thinning injections daily. You'll be taught to administer this to yourself, and you will be given everything required to do this. This is to reduce your risk of any blood clots or deep vein thrombosis. Your compression stockings will be provided for you as part of your discharge pack. You will be expected to wear these for 6 weeks, and they should be removed daily and the skin checked for redness and blistering, and then put back on. So these stockings should be worn for 24/7 really during that 6-week stage. Only removed to check the skin integrity. If you've got any concerns with skin integrity, please call the hospital on 01536 536 811. Now, this is an important part of today's session, your clip removal. You must book an appointment with your GP surgery for 14 days after the operation, as we do not remove the clips here at Woodlands Hospital. So just to confirm, book an appointment with your GP surgery for your clips, staples to be removed 14 days after the date of the operation. If you're returning to work, please be advised by your consultant. When it comes to flying or travel in a car, we advise you to avoid long-haul flights for the first 3 months. And when it comes to your car journeys, traveling as a passenger, I would say increase your breaks on those journeys. So for every 30 minutes you're in the car, you're doing a 10 or 15-minute walking break just to reduce any tightness or stiffness. Okay, just to reiterate some general advice that we've already touched on, we do want you to follow your hip precautions. They keep you safe and significantly reduce your risk of dislocation in those first 12 weeks. Find the right balance between rest and exercise after a total hip replacement. You can't speed the recovery up by doing more. So find that right balance. Take regular breaks throughout the day. Listen to your body. Sleeping on your back for the first 6 weeks following this surgery, and sleeping on your back or the operated side between weeks 6 and 12. Using issued equipment and aids for at least 12 weeks following the surgery. When it comes to washing and showering, you are allowed to shower as normal. If your shower is situated in a bathtub, you are advised to have a strip wash because it can be because it can be difficult to get in and out of the bath. So just to reiterate, if your shower is situated in a bathtub, then you're advised to have a strip wash. When showering, please keep affected limb away from the full force of the water. The dressings are shower-proof and should not be removed. If the inner pad of the dressing is wet, it should be changed. If there is leakage outside of the dressing, please apply dressings over the top and contact the hospital for further advice or treatment. The key thing in terms of safety is taking extra care as you get in and out of the shower whilst you're walking around these slippery surfaces. Maybe consider a shower seat or a bath board if you have any difficulties. If you show any signs of infection or any signs of blood clots or DVTs, these are the red flags that we would expect you to contact the hospital. So just to clarify, if you're exhibiting any of the symptoms you can see on the screen, please do get in contact with the hospital right away. Now we've got some useful contact numbers on the screen for you now. You may wish to take a photo of these numbers. After a total hip replacement, you can need a little bit of additional support, whether that's help with non-emergency transport to and from your hospital appointments, or emergency food and meals, assistance with shopping, or even mobility aids and that sort of thing. So we've got some useful info on the screen there for you. Now, after the surgery, you will need some assistance at home, particularly for the first 3 or 4 nights following your discharge. So we like to refer to your home carers or your friends and family as a coach. So coach is handy for getting you to and from your hospital appointments, obviously getting you discharged from the hospital, a little bit of motivation to exercise and walk, and some assistance taking your surgical stockings on and off. And generally, it's support of everyday life. When it comes to preparing the home, coach can come in handy there. Make sure that you've got a clear pathway around the home, bearing in mind that you will be walking with 2 walking sticks at this stage. Move all those frequently used items to waist level. If you've got things that you kind of have to bend down for, if you bring those up to the waist level, that's going to make life easier for you and safer within your precautions. And be sure to eat well after a total hip replacement. Make sure you're consuming enough calories of a well-balanced diet, lots of protein, lots of green vegetables, that sort of thing. That's what's going to turn your hard work with your exercises into nice, new, strong muscles. We advise you to cease housework for the first 4 to 6 weeks following the operation. So no hoovering, no painting, no gardening, cutting the hedges, mowing the lawn, and that sort of thing. So some top tips on the screen now. We're near to the end of the presentation. When we say do as much as you can for yourself, this isn't to do with starting a new DIY project or building a treehouse or anything like that. It's more to do with maintaining your independence. So don't allow your new hip to be a passenger throughout your recovery. Try and strive to get back to whatever your normal is. Have a look at your exercises before the operation. And when we say have a look at them, we mean have a go at them. So begin those exercises before the surgery, even if it's only 2 days worth. You know, familiarizing yourself with the home exercise program can improve your understanding and help with your recovery. Now, we don't want to sugarcoat it. As we've discussed, a total hip replacement is a major operation, and we expect your hip to be painful, bruised, and swollen, and this is normal. But bearing in mind, we want to help and manage those symptoms alongside you. So take your painkillers regularly. Effective pain management will enable you to improve your mobility and practice your home exercise program with reduced discomfort. And a regular routine will assist in your recovery. When it comes to exercise and walking, we advise you to do a little bit of everything quite regularly. So apply yourself to that home exercise program. This will improve your strength and your movement and help you get back to your normal. And be patient. It's really important to understand that the effects of this surgery, it takes a little while to heal from these. So it can take 6 to 8 weeks of regular strength exercise to build a muscle, and you're looking at about 12 weeks for the soft tissues to heal from the effects of the surgery. When it comes to walking, pace yourself. Judge yourself on good quality walking rather than time spent or distance traveled. And start small, work slowly to increase your distance and pace. Any questions, please don't hesitate to give us a call on 01536 536 814. Thanks very much. This concludes today's pre-assessment for a total hip replacement. We'll see you when you come in to the hospital. Bye-bye now.